Hello everybody, welcome to my YouTube channel. This is Akil, your online pharmacist. In today's video I'm making about frostbite. As all of you are aware, in Canada we are under severe cold warning right now, so it's a good time to know a little bit about frostbite. So what is frostbite? Frostbite is basically the skin freezes and the tissue under the skin also freezes sometimes. That is due to extreme cold temperatures and exposure to extreme cold temperatures. So the risk factors are the temperature is below minus 15 degrees. We are currently at minus 50, so it's very, very extreme. People who have other medical conditions like diabetes, people who use alcohol excessively, they are at high risk. And people obviously who don't dress warm, that's another risk factor. So the common areas that are at risk for the frostbite are your exposed areas, like your nose, your cheeks, and your ears, your hands, your fingers, your foot, your toes. So those are the common areas that are at risk for the frostbite. If you don't cover them properly, you can get frostbite anytime. So what you can do to prevent the frostbite, obviously dress warm, keep yourself covered in different layers. Don't go out if you absolutely have to if the temperature is below minus 15, which is kind of impossible here because we have it very low temperatures. And if you've been drinking lots of alcohol, don't go out too because that puts you at risk for having severe frostbite. So what are the symptoms of frostbite? The first one is like your exposed areas start feeling numb, or you might have experienced tingling in that area. Your skin also starts looking like pale or discolored. So those are the common symptoms of frostbite. Frostbite can be mild, it can be severe, and the treatment is based on that. So what you can do if you have frostbite, first thing first, you need to go indoor or in the warm area, whatever is feasible. Try to remove the wet clothes. Just make sure you're not ripping your skin off. Just be careful with that one. If you're wearing tight clothes, remove them. If you're wearing some sort of jewelry, remove that one too. Another thing that is commonly done is like people start rubbing the skin. That is not good if you have frostbite because that can worsen it. Next thing you can do is like do not heat your hands or your feet or whatever area is suspected to have frostbite under direct fire or like using other warm sources. Next thing is to start rewarming the area. So the easy way to rewarm is under mild, warm running water, not hot water. And you can put your hand or your foot under the mild running warm water for like 30 minutes to an hour. And that will give enough time for the fingers or for the feet or any other frostbite area to thaw and start rewarming. If you cannot do that, you can use your armpits, you can use the groin area, or your belly area because those areas have higher temperature and the rewarming starts easily over there. And the other thing is just look at that area if after rewarming. If you start seeing blisters and skin is pale or any other color, you need to go to the emergency. The other thing you can do is like for pain or inflammation, you can use any of the anti-inflammatories like Advil, Aleve, Motrin, any of those. You can also use some topical antibiotics if needed. Otherwise, you don't have to use them. But as I said, like if the skin looks really damaged, you need to go to the emerge right away. So if you have any questions and concerns or you want to know more, just let me know. Please share, like, subscribe. Thank you very much and have a good day.